According to the American Kidney Fund, more than 37 million people in the United States are living with kidney disease and don't even know it. According to the National Kidney Foundation, CKD is ranked as the 9th leading cause of death in the United States alone. Scary, right? Now imagine finding the solution to repairing and healing your kidney issues tucked away in a single bottle of vitamins sitting in your cabinet. Chronic kidney disease, or CKD, is a serious condition where the kidneys gradually lose function over time. The kidneys play an important role in filtering waste and excess fluid from the body. When they malfunction, harmful substances can accumulate in the bloodstream, leading to kidney damage. One subtle sign of kidney damage is proteinuria, also known as albuminuria, which is a condition where proteins are found in the urine. This condition can lead to serious health complications if left untreated. Thankfully, there's a vitamin that can give your kidneys the boost they need to effectively fight against proteinuria. In this video, we'll be revealing the powerful vitamin that can stop proteinuria quickly and repair or heal kidneys fast. From its antioxidant properties to its anti-inflammatory effects, we'll be discussing how taking this vitamin can be a powerful boost to your kidney health. So if you're looking for a potential solution to support your kidneys and improve your overall well-being, you're in the right place. We'll break down the science behind this potent vitamin by uncovering its amazing health benefits and revealing some tasty foods rich in this vitamin that can boost kidney health. How proteinuria affects your kidneys. Your kidneys perform the vital task of filtering blood to remove waste products and excess water, which are then expelled as urine. However, when the kidneys are damaged, proteins may pass through the filters and enter the urine, a condition called proteinuria. The manifestation of proteinuria can vary depending on the root cause. For example, with some types of kidney disease, proteinuria can be intermittent, while with others, it may be constant. The amount of protein lost can also vary widely, ranging from small amounts to large amounts. A routine urine test can be the first step to discovering kidney disease before any symptoms appear. This discovery may seem frightening, but it gives you and your doctor a chance to treat the underlying cause before serious damage occurs. A normal urine sample should have 0 to 14 milligrams of protein per deciliter, mgdl. However, this can vary depending on the time of day and how much fluid a person has consumed. Proteinuria is often measured using a 24-hour urine collection method. In this process, levels below 80 milligrams per day are deemed normal, while values exceeding 80 milligrams per day are considered abnormal. The severity of proteinuria increases with higher values, aiding in the evaluation of a person's risk for kidney disease. Types of proteinuria. Proteinuria is classified into 3 main categories: transient, persistent, and orthostatic or postural proteinuria. Transient proteinuria is a temporary condition characterized by an unusually high presence of protein in the urine. Think of it as a brief, surprise party taking place in your pee. Normally, your kidneys efficiently filter your blood, retaining essential substances like proteins while eliminating waste. However, in transient proteinuria, some proteins bypass the kidney filters and appear in your urine. The good news is that transient proteinuria is not a permanent condition. This proteinuria often resolves on its own, allowing your body to return to its usual functions, with your kidneys continuing their amazing job as an effective filtration system. This type of proteinuria is frequently observed in pregnant women and generally poses no significant concerns. On the flip side, persistent proteinuria extends beyond a few weeks and is typically linked to chronic kidney disease or other ongoing kidney-related issues. Common culprits include conditions like diabetes, high blood pressure, and chronic kidney disease, along with taking certain medications like nonsteroidal anti-inflammatory drugs or NSAIDs. Treatment for persistent proteinuria varies based on the underlying cause, but typically involves lifestyle adjustments, medication management, and ensuring adequate intake of the appropriate vitamins. Postural proteinuria is the 3rd type of proteinuria, occurring when a person remains standing or sitting for a long period. The upright position places increased pressure on the kidneys, leading to the leakage of proteins into the urine. This condition is relatively rare and primarily affects children and teens. However, there's no need to worry. While postural proteinuria usually doesn't signify kidney problems and tends to resolve on its own without treatment, it can be triggered by underlying conditions like diabetes, immune disorders like lupus, high blood pressure, or kidney disease, as well as certain medications. Interestingly, when a person with postural proteinuria lies down, there's a good chance the proteinuria will resolve itself. Symptoms of proteinuria and prevention. In the early stages of milder cases of proteinuria, many people may not notice any unusual symptoms. But as the condition advances over time, symptoms may become more apparent. These can include foamy or bubbly urine, swelling in the hands, feet, belly or face, fatigue, poor appetite, and high blood pressure. Instead of going through the stress of taking lots of medications, there is a powerful vitamin that can effectively help to stop proteinuria and repair your kidneys fast. This vitamin is none other than vitamin D. The best part of taking vitamin D is that you don't have to worry about any side effects. Vitamin D has been widely promoted as a beneficial supplement for people with chronic kidney disease, based on observational studies of both healthy individuals and those with chronic kidney disease. Scientific studies have revealed that vitamin D plays an important role in maintaining healthy kidney function. Vitamin D not only aids in slowing the advancement of kidney disease, but also protects the kidneys from additional potential harm, including renal failure. As a fat-soluble steroid, vitamin D demonstrates non-bone-related effects such as improving glucose regulation, reducing heart disease risk, and fighting inflammation and cell overgrowth. In fact, vitamin D is also beneficial for your body's calcium and phosphorus balance. It supports your parathyroid glands, which are small glands in your neck, in producing the right amount of parathyroid hormone, or PTH. This hormone ensures strong bones and maintains balanced blood calcium levels. When calcium levels drop or phosphorus levels rise, PTH comes to the rescue by releasing calcium from your bones into your bloodstream. High PTH levels have been associated with nephrocalcinosis, which is a condition where calcium crystals accumulate in the kidneys. This can lead to several serious complications, including proteinuria. When calcium crystals build up in the kidneys, they can cause damage to the filtration system, leading to the loss of protein in the urine. Vitamin D is also responsible for balancing calcium and phosphorus levels to prevent secondary hyperparathyroidism, which is a condition where the parathyroid glands become overactive. Excessive calcium in the bloodstream, resulting from this condition, can lead to the accumulation of calcium alongside other stone-forming substances like oxalate, phosphate, or uric acid, potentially forming kidney stones. This creates an environment conducive to kidney stone formation, therefore encouraging these substances to bind together and crystallize, leading to the development of kidney stones. On the other hand, when there's enough vitamin D in the body, it promotes adequate absorption and reabsorption of calcium and phosphorus, ensuring that kidney cells have the necessary resources to perform their functions effectively and maintain kidney health. These minerals play a major role in various cellular processes, including energy production, cell signaling, and maintaining cell membrane integrity, which can aid in the maintenance of kidney structure and function. It's important to understand that high blood pressure is a big threat to your kidneys. What's even worse is that it can cause a problem called glomerular hypertension, where the blood pressure inside tiny blood vessels in the kidneys gets too high. This can damage a part of the kidneys called the glomerular filtration barrier, leading to protein in the urine. But when you have enough vitamin D, it stops the kidneys from making a substance called renin, which helps lower blood pressure. This means less tight blood vessels and less of a hormone called aldosterone, which also helps lower blood pressure in the body and kidneys. We also have the vitamin D receptor, or VDR, which is a protein that is found in many different types of cells, including those in the kidneys. When activated by vitamin D, VDR can turn on or off certain genes that are involved in kidney function, inflammation, and fibrosis. This action helps prevent proteinuria by improving how the kidneys' filters and cells work. Plus, vitamin D's antioxidants protect the kidneys from oxidative stress, preventing proteinuria. When it comes to oxidative stress, it plays a big role in kidney disease. This happens when there's an imbalance between the body making reactive oxygen species, or ROS, and its ability to defend against them with antioxidants. ROS are reactive molecules that can harm the glomeruli, making them more permeable and causing the protein to leak into the urine. However, vitamin D acts as an antioxidant, stopping ROS from causing damage. But that's not all. Vitamin D can also boost the activity of antioxidant enzymes like superoxide dismutase, catalase, and glutathione peroxidase. These enzymes are essential for neutralizing ROS and keeping the balance of chemicals in cells just right, which helps prevent proteinuria. Source of vitamin D. And did you know that there are various ways to get your vitamin D, with the main source being sunlight exposure? That's why it's commonly called the sunshine vitamin. When your skin is exposed to sunlight, your body makes vitamin D. But in many parts of the world, the sun's rays are not strong enough to produce adequate amounts of vitamin D, so you might need to get it from other sources. Food sources of vitamin D include fatty fish, such as salmon and tuna, as well as fortified foods like milk, cereals, and orange juice. Certain mushrooms like lung oyster mushrooms also have a significant amount of vitamin D. Vitamin D supplements are equally available and may be necessary for some people. Although vitamin D offers many benefits to your kidney and overall health, it's important to consume it in moderation. Your individual vitamin D requirements may vary based on factors like age, skin tone, diet, and location. To determine the appropriate vitamin D dosage for you, consult your healthcare provider. They can assess your needs and advise you on the safest intake level and the most suitable way to obtain it. Now tell us, how often do you take vitamin D to stop proteinuria and protect your kidney health? Share your thoughts in the comments below. Don't forget to give this video a thumbs up, share it with others, and subscribe to our channel for more informative and eye-opening content like this. See you in the next video.